Good afternoon and welcome to the COVID-19 update meeting for Friday, June 19th. This meeting is being recorded and will be posted online at wasac.org/coronavirus within 48 hours. If you have any questions or comments, please use the chat feature located at the bottom of your meeting window. All entries in the chat window and this recording will be retained as a public record. If you would like to speak, please use the raise hand button under the participant section. For those participating by phone, you can raise your hand by pressing 9 and today's moderator will call on you. Otherwise, you can mute and unmute yourself. If more than one commissioner from a county is participating in today's meeting, this meeting should have been notified or noticed as a public meeting. Any guests in attendance should remain muted. Thank you for joining today, and now I would like to welcome Jamie Bodden.
Thank you, Jason, and happy Friday, everyone. Hopefully your weekend will be full of good weather and you'll be able to get out and enjoy some sunshine. Go ahead and move to the next slide, Jason. Just a reminder, the webinar is being recorded and those have been posted at the WASAC website around 3 days after our webinar for folks to access. And please utilize the chat box. We have a number of guest speakers today, and so we would love to have you ask and pose your questions to them via the chat box. Go ahead, next slide, Jason. So today we do have guest speakers from Northwest Harvest to talk about some food security issues. And then we also have folks from the governor's office to join us as well to talk phases and in particular phases 3 and some hopefully maybe some insights around phase 4. We do have a couple of important updates for you all from this week. Melanie will kind of go over some of the things around special session and what we are hearing, as well as the revenue forecast that came out earlier this week. And then should time permit, we'll be able to do a quick roundtable as well. So next slide, Jason. It is always great to be able to get guest speakers to join us for these webinars. And what was great about Northwest Harvest is that they reached out to WASAC to see if they could provide an update for us. So we really appreciated that. And I'd like to turn it over now to Christina Wong from Northwest Harvest to give a brief update. Christina, feel free to unmute yourself and take it away.
Thank you, Jamie, and thanks so much for the reminder to unmute myself. I'm sure we all do that at least once or twice a day on these calls. And speaking of which, my very first caveat that I start all presentations with these days is just to let people know that I do have a 6-year-old and an 8-year-old who are home with me. It's their last official day of school, and so they are punchier than ever. So if you hear any background laughter or noise, that's the 2 of them. And one of them just said, "We can hear you." So anyway, what I would like to share with you all today is information from a report and projection model that we recently released regarding when we might expect to see peak food insecurity as a result of COVID-19. Because we feel like this is really important information for county and county governments to have, especially now during this time period where there's some funding that's being made available from the federal government that is specifically around, well, gives you flexibility, but also some of the funding that's specifically around helping to support food access. So just having this information to help you in your planning and discussions. Next slide, please. So here's my agenda just so you can follow along with me. I'm going to start with just a brief overview about Northwest Harvest and our work during COVID-19. I'm then going to talk a little bit about the state's food security coordination team as background for why this report was made. I'll then turn to talking a little bit about the report methodology so you can follow along with me as I talk about key findings. Then I'll sum up what's the key takeaway in terms of what food security insecurity looked like before the pandemic and what we're predicting will be happening during the pandemic as well. Last but not least, I wanted to offer you, we don't normally follow local issues because we are a statewide organization. We work on state and federal issues, and so I can't really speak to specific local policy ideas, but I wanted to offer you what are some of the major needs and resources that are happening in the food insecurity realm right now as a result of COVID-19 for you to take into consideration. And then I'll be available for questions. Next slide, please. So a little bit about Northwest Harvest. I'm sure that many of you no doubt know us for being Washington's independent statewide food bank. And when I say statewide food bank, I'm using terminology that the rest of the country uses that's different from Washington state, meaning that we provide nutritious food to 375 frontline food pantries, meal programs, and high need schools. 60% of what we distribute is fresh or frozen produce, primarily sourced from right here in Washington state. And then we also focus on some key nutritional staples, things like dried beans, rice, oats, lean proteins, and canned meats and peanut butter. In addition to operating as a food bank, we also operate the Soto Community Market, which is located in South Seattle. We're actually coming up on our first year anniversary of the market being opened. You could call this a food pantry, but we're really trying to stay away from that terminology because we wanted to create a really enhanced, dignified experience for people to make it feel just as if they were in a regular grocery store and not having to come to a food pantry in order to ask for help for food. So when you come to the Soto Community Market, it looks and feels just like a grocery store. All we do when somebody comes in is they are greeted by a volunteer and asked to provide a name as well as a breakdown of what the different age groups are in their household. Then they take a shopping basket and they shop for whatever their needs are. When they're done at the checkout counter, a volunteer will then pack up their groceries for them, but no money is exchanged. So we're really excited about the Soto Community Market and the great work that it's been doing in this community. We also have a hunger response network, and they provide support, including basic nonprofit support and best practices in food pantry work to that statewide network of food pantries. They also are working with local government and with different new partnerships in the private sector, including in the healthcare sector, also with some of the major corporations that we have in our state, including Amazon and the major healthcare systems, in order to create more food access points and partnership for people. And then last but not least is my work in the advocacy space. Again, we work on state and federal issues. We operate a two-tier agenda where our top agenda is to focus on protecting and strengthening access to nutrition assistance programs, things like basic food or SNAP, formerly called food stamps, WIC, school nutrition, summer meals, the whole gamut of those programs that are publicly funded that are helping people put food on their tables. And then we also work on a support agenda, elevating issues in housing and homelessness, access to affordable healthcare, and promoting economic stability. We make it clear in that support agenda that we're not the policy experts on those issues, but we're there to talk about the connection between hunger and those issues, because we know that the reason why hunger persists is because people are really feeling with their limited resources that they have to make choices between necessities. And so rather than saying food or housing, we believe that should be a false choice and that we should be providing people with both the food that they need in order to stabilize crises and not feel like they have to skip meals in order to pay the rent. Next slide, please. So during COVID-19, Northwest Harvest, our food distribution work has shifted a little bit. Starting with, we have a partnership with the State Department of Agriculture and with Second Harvest and with Food Lifeline, the two Feeding America affiliates in our state, to provide pre-packed emergency food boxes. That was in direct response at the start of the pandemic when stay home orders were put in place, recognizing that people might not be able to get out to their grocery store, both because of limited mobility and also because they're concerned about their health needs too. So those emergency food boxes were packed with shelf-stable food items, things like canned meats, canned fruits and vegetables, peanut butter, macaroni and cheese. So those shelf-stable items instead of fresh produce. And the reason why we were pre-packing those boxes is because across the state, those frontline food pantries, you probably have heard from them about the significant decline that they saw in volunteers and staff because of social distancing requirements and having volunteers that are primarily in those high-risk populations of seniors and people with disabilities or having their own family members to take care of. So what we are doing is we are pre-packing boxes for them because that takes some of the labor requirements off of them. Our work is being supported by National Guard units. And then what happens is those boxes are shipped out to those frontline food pantries. So that way they can put them in cars at curbside pickup or even do home delivery with them. In that emergency food box work, we have each of the three major NGOs, so between our Northwest Harvest, Second Harvest, and Food Lifeline, we have actually been given around 13 counties to focus our work and the resources that we are acquiring to respond to COVID-19. So Northwest Harvest, instead of distributing food statewide during this pandemic, at least through July 31st and having started on April 1st, our work has been focusing on 13 counties that were assigned to us by WSDA. But just as a quick aside about the indications about levels of need, at the start of the pandemic, Northwest Harvest put together for the state a rapid needs assessment so that we could get some sort of idea about what might be the increase in food insecurity in our state. We looked at how many people were food insecure before the pandemic started, how many children are eligible for free and reduced price school meals, how many seniors are living in poverty, and what have been those applications for unemployment. And in just our 13 county assignment, for perspective, last year's numbers when we were serving statewide, there are about 790,000 visits to our statewide network of food banks. In just our 13 county assignment, our needs assessment projects that we're serving 768,000 individuals, so nearly as many as people as we served statewide last year. And because your county officials, that needs assessment actually projects that we're serving about 60% of the total statewide need between South King County, which has about 30% of what we are predicting is the current food insecure population, and Pierce County, which has 31%. So that's the emergency food box strategy delivered within 13 counties. Those emergency food boxes, as the pandemic has been going on and people are starting to be able to get out of their houses more, we are also shifting what we are packing in those emergency food boxes. So we're still providing those shelf-stable items, but now we also have a vegetarian box, which can be adapted with halal meats for individuals who need that religious accommodation. We are also starting to produce fresh boxes, so we're reintroducing fresh produce with a partnership that we have with Inaba Farms in Yakima. And then we are also providing meals ready to eat boxes for people with limited or no storage or food preparation, usually people who are unhoused. The other part of our COVID response has been working with non-traditional partners, organizations that had no previous experience in food distribution. And that's because they are responding to identified need for food from the people that they serve, people who haven't been able to get to their local food bank, either because of decreased capacity from public transportation or the working hours that they have, still working essential jobs, not lining up with the food pantry in their area, And also most primarily, it's the seniors and people with disabilities, people with immunocompromised conditions who are in need of food but can't get out of their house. So some examples of how we're working in this area is we are partnering with World Relief, which is a refugee and asylee resettlement organization serving in Seattle and South King County. We also have been working with a senior housing in Pierce County and Tacoma to get our emergency food boxes to those organizations that are delivered to where people are at. And in our advocacy work, a lot of our focus has been in working with our congressional delegation on those COVID relief packages, including making strong arguments for increases to state and local stabilization funds, and also working with our state agencies to implement the changes that have been made to our nutrition assistance programs. Next slide, please. So this turns my attention now to our report methodology. I'm actually wondering if I might have messed up my slides. I'll start yeah, I might have missed putting in a slide that I previously had in there. So I'll talk a little bit about So I wanted to first address the food security coordination team for the state. This was appointed by the governor back in March and is bringing together the different state agencies plus staff from the governor's office and from OFM to look at what are the needs in our state when it comes to food insecurity and making sure that we are looking through the available resources so that we can line up the resources in place to mitigate food insecurity. So working towards that end, this report was commissioned. What this report is attempting to do is to figure out when Washington might expect to see a peak in the food insecurity crisis in our state, and what would be the resources that are needed to address or prevent food insecurity. So that website address below the picture below there, that's where you can find the full report, as well as a 4-page policy briefing, which summarizes the key findings from the report and what are our state and federal policy recommendations based on the report findings. But I wanted to talk through the methodology for that report. What we did was, or what the consulting firm who put together this prediction model for us, they looked at what are the job sectors that have been represented in unemployment applications to find out what jobs have been most disrupted by COVID-19. They also did a survey of CEOs both nationally and in our state, and then also talked with economists to check out what the findings were. But the survey of CEOs was an attempt to predict when there might be peak unemployment in our state. And then the other part of the methodology that is key to talking through the findings, and the next slide will be about findings, but what the methodology behind that was in order to see what the resources might be between what are the number of people who are food insecure and people who have food security. So what would be the resources that we need in order to prevent food insecurity in our state? They looked at what's the difference in spending between food secure households and food insecure households. And the spending for food insecure households was offset by public and private food assistance resources. So things like SNAP, school meals, summer meals, WIC, as well as the value of the food that households are getting from food banks. So next slide, thanks. So these are the key findings. So it starts with noticing that unemployment and poverty rates are the most highly correlated factors to food insecurity. That is pretty much common sense. Food insecurity is experienced when people don't have enough resources to make make ends meet at the end of the day. So unemployment and poverty rates are the most highly correlated factors to predicting food insecurity. When they looked at what jobs have been most disrupted by COVID-19, they found that 88% of the jobs that were lost or at risk of being lost are held by people who earn less than $70,000 per year. And even within that, 60% of those jobs are held by people who make $40,000 or less per year. So, and the other thing that they found is that people of color are disproportionately impacted by these job losses, particularly Latinx communities who make up 13.1% of the job holders of these jobs that have been most disrupted by COVID-19. So the way that the prediction model then works, it's working on this theory that the Congress passed enhanced unemployment benefits, where people's unemployment benefits are $600 per week. And when you look at the fact that the majority of households, those 60% of people who've been most impacted by COVID-19 job loss, are making $40,000 or less per year, the enhanced unemployment benefits are actually helping them out right now, helping them make ends meet because it's effectively replacing their lost wages. And in some cases, actually helping them out even more. So even though food insecurity, we know that from our food bank lines that there's been tremendous increases in people seeking out help for food, we're actually doing okay, relatively speaking, because those enhanced unemployment benefits are helping people buy food and pay for other essential needs. This means that our concern is that those enhanced unemployment benefits are scheduled to end July 31st. So when you, and then when you take into account that CEO and economist survey, they are predicting that with a second round of infection could mean that unemployment, like Washington actually hasn't seen our peak unemployment. That would actually be happening in the later part of our year between August and December. The combined factors of increase or peak job loss with the loss of those enhanced unemployment benefits means that that is the peak period where we would see peak food insecurity. So, so if I could actually go to the next slide just to talk about, to sum up what the numbers mean, and then we'll go back to that previous slide to talk about resources. So what this means is before the pandemic, we knew that 851,000 Washingtonians, or roughly 1 in 10 households, were struggling with food insecurity. During the pandemic, our rapid needs assessment, and it's been backed up by this projection model, we could see anywhere between 1.6 million people to 2.2 million Washingtonians struggling with food insecurity. And that's roughly 1/4 of Washington State's population. But the key difference is that USDA defines food insecurity as not having enough resources to afford the basic nutrition that you need in order to have an active, healthy life. Hunger is very severe food insecurity. Hunger is when you persistently are skipping meals and have disrupted meal patterns, where there's actually starting to take a physical health toll because you don't have enough resources to put enough food on your table. And so pre-COVID-19, Washington's hunger rate was 4%. Under our prediction model, Washington's hunger rate could peak up to 13%. So 13% of Washington's households could be struggling with that deep hunger. And for context, what we're saying is, what we're thinking is happening now is the increase that we've been seeing at our food pantry doors, that is showing an increase in food insecurity. And the prediction model is backing us up that about 2.2 million people are struggling with food insecurity. But hunger is that subset of that 2.2 million people. And that's what makes it taking a crisis into catastrophe, really, because it's such a significant jump of people who would be facing that deepest, lowest food insecurity, what we're actually talking about hunger. So if I could go back to the previous slide, I'm going to talk a little bit about the resources piece. what the prediction model then does is it attempts to assess what would be the resources we need in place in order to prevent people from experiencing food insecurity. So again, the methodology behind it was that they took how much people on average who are living in food secure households are spending on food versus what on average people who are living in food insecure households are spending on food. And then they adjusted what food insecure households are spending by public benefits that are available to help with food, as well as what they're getting from food banks. And they found that the gap could be, during that peak food insecurity period, could cost as much as $115 million per month in resources that would be needed in order to prevent food insecurity. What I want to say is that's a statewide figure, and it's also one that has not been peer reviewed, and that we would really love, that we're putting this out there to get feedback and help us adjust that methodology assessment. But so far, we haven't heard specific arguments picking apart that piece. But this is a high-end estimate of $115 million per month. The other thing I wanted to make sure I mention here, and I can forward it to you when it's available, we're in the process of finalizing it right now, is that the consulting group that put together our prediction model also put together a dashboard for us that provides this gap information at the county level. So I think that will be really key and important for you all to have, and we'll forward that when it's available. Can I jump 2 slides now, please? So the reason why I want to have this here is this is dire sounding news, isn't it? And I'm sure it's dire news on top of other dire news that you've heard. But you know, it's a prediction model, and you know, whether or not you believe that psychics are accurate, we always have the power to change our future based on what we do today, knowing that we have this information and what resources we might be able to put in place. So if I can get to the next slide, I'm just going to quickly go over what have been some of the areas that we think could most help with funding investments and policy changes that can be helping us provide more food and cash resources. And that first part on there is cash assistance. Whether you see that in the form of the ability to provide direct cash payments like the stimulus checks, or I know there's a lot of discussions around creating a worker relief fund for undocumented immigrants who are working so many of our essential jobs, but can't take advantage of paid sick leave if they get sick, or unemployment if they lose their jobs because of closures of facilities due to COVID-19. But cash assistance really has been key, as we're seeing in those enhanced unemployment benefits, because cash assistance is what's keeping people whole. It's unlike food assistance, it can be spent as needed on whatever essential needs that you have. We also think that there would be a lot of help that could be provided if there are increases to state and local rent and mortgage assistance programs, especially because when those moratoria are up, I know we've all been discussing about what's going to be happening for people who owe back pay on that. When it comes to food assistance, one of the non-cash assistance things that could be happening that resources would that we would value resources on is cold storage capacity for food banks. And that's because so much fresh food has otherwise been going to waste and are now available in in boxes that are being provided by USDA, in our own efforts to vary the food that we're putting out to the emergency food system. But the volume of food that's been backlogged and could be given out, it's perishable and could go to waste for the simple reason of that food banks and food pantries, we need more cold storage capacity in order to safely store that food until it's ready for distribution. So cold storage capacity and other infrastructures. Other things to help food banks safely distribute food include PPE and other infrastructure they need in order to follow guidelines safely. We also need to take a look about what's been happening in the schools and their budgets. The school meal distribution sites that have been widely available throughout the state, it's been really key. Their existence has been key, but overall, about 50 to 60% of the students who normally participate in school lunches when schools are open have been actually participating, accessing school meals through the distribution sites. And the biggest contributing factor to that is just the sheer fact that kids aren't in school. So families having to get to school meal sites, or if they miss the days that meals are being delivered to them. But school meals, their funding depends on participation rates. They get reimbursed by the federal government for every meal that they serve. So we're looking at a situation where there's been significant decrease in participation in school meals. At the same time, the costs of providing meals at distribution sites and not in schools have been significantly greater, paying for PPE, sanitation supplies, supplies to pack things up to go, paying hazard pay for labor. And that hole that's been blown into so many school districts' budgets also takes a toll on what we will likely be seeing during the summer months, because many of the schools that could be operating summer meal sites for kids might not be doing so because they've lost so much funding from the school year. So really looking into what is the magnitude of what's been happening to your with your local schools' nutrition budgets, and if there's any additional support that could be provided there is another really key thing that could be happening on the child nutrition front. We would also, another great area would be any possibility of putting funds towards supporting outreach efforts about the Women, Infant, and Child Supplemental Food Program, or WIC. You know, that's food that's given to pregnant nursing moms, infants, and children under the age of 5 to help reach targeted needs. What we've been seeing during the pandemic is that there has been an increase in the number of families who were eligible and enrolled in WIC but not previously using their benefits. And we think that's because of social distancing, USDA granted waivers that are allowing many of the services that are associated with WIC to be provided remotely, and also providing flexibilities based on food supply disruptions in stores so that people have an easier time actually redeeming and using their benefits. What we have not seen, though, is an increase in new applicants for WIC. But this is another resource that can be helping families put food on their table. So any help that can be done there to help with outreach. On the summer meals front, and then a new program, Pandemic EBT, support for doing outreach about those programs. Pandemic EBT, I won't go into the super wonky details about it, but this is a new benefit that's rolling out in Washington State and would provide a pretty significant benefit to eligible families. It's for families that have a student or students that are eligible for free and reduced price meals. The benefit could be as much as $399 per eligible child. That could be spent on groceries and stores to replace the meals that have been missed while schools have been closed. And then the last area to think about for local governments is that many counties have made your public transit authorities available to food banks and senior centers to help with home meal deliveries. But as we are reopening and transportation is going back to its normal routes and operations, that resource is being lost, but we still have homebound people at home who could use that assistance. So those are just some ideas to think about. And I'll leave it there and turn to questions.
Great, thank you, Christina. Really, really informative, and I think something that is near to a lot of our commissioners' hearts on this. We do have a question. I think it was around the cash assistance point on this slide, of any estimate of how much cash assistance is spent on non-essential versus essential needs.
You know, that I don't have off the top of my head. I can look into it, but we're pretty sure that that people are spending it on essential needs. It's been maybe the people who are in because we operate from the standpoint of trusting that people know how to spend money that's in their best interest. So so people have been putting it towards paying for food, paying for rent. This is exactly going towards our points about it's not cash assistance, but the cash equivalent when it comes to SNAP. The reason why SNAP is uniquely poised to help us through both the economic crisis and the public health crisis of COVID-19 is because it's spent on an essential need of food. It can only be spent on food. And as such, because it's being used to buy food from grocery stores and from other certified retailers, it's helping to keep our local and also farmers markets. It's helping to keep our economies running. So, I mean, I would say, yeah, I would say I don't have an exact breakdown on that. I could try looking up, but the theory behind cash assistance is that people are spending it on essential needs. And there are, if there are people who have been eligible for it, who feel that they are getting by on what they're doing, I can tell you that at Northwest Harvest, we've seen a number of people who have handed over their entire federal stimulus checks to us because they said that that they're doing just fine and want to help other people.
Great, thank you. Commissioner St. Clair, I know you had a question, and I think it's probably easier if you just ask it yourself. So if you are able to unmute yourself, go ahead and ask your question.
Hi. I hope you can hear me. It's I've got a very terrible internet connection. Is it okay, Christina?
Yes, thank you.
Okay, so we live up in the Northwest region, 5-county, Whatcom, Skagit, Snohomish Island, and I've talked with this with a couple other commissioners. We have a real challenge with finding, you referenced it in one of your slides, that cold storage issue, and trying to get down to the Kent Distribution Center is very much a logistical challenge for many of our local food banks. At one point, I talked to folks over when Shelley was there and then the new executive director about the possibility when the Twin City Foods came up for sale of doing a food distribution center in the Northwest region. Is that ever a possibility? At the time you were immersed with a succession issue as well as the Cherry Street move. Is that possible? I think that's something that would be of significant benefit to food banks up here.
Yeah, I mean, I will take it to our operations team right now. Like I said, we're focusing on under our partnership with the state during at least through the end of July. We are still operating in just 13 counties, and Food Lifeline is actually the lead distributor for that area. But I will, but when we return to going statewide, I'd be more than happy to talk with our operations team and ask. And I also know that we work with the Bellingham Food Bank as a sub-distributor of ours to get our food out to the food banks in that Whatcom area, and then I believe we work with Skagit Cap for Skagit.
I appreciate that. You are cutting in and out, so I'm just gonna let us talk offline because all you're doing is cutting for that. But I can't hear. Eric, I'll follow up with folks after this.
I can also put my email address in the chat box so that people can follow up with questions that way.
Ah.
That would be great, Christina. Thanks. Yeah. We do have another question. You referenced the 13 counties that you're serving. Do you perchance know that off the top of your head what those 13 counties are?
Let's see if I can remember. It might be a test. So we are serving, it's not a whole county, right? But we are serving South King County, Pierce, Yakima, Okanagan, Chelan, Douglas, I want to say Wahkiakum and Pacific, Clark, I got 9 off the top of my head. I will, let me see, did I forget any of the ones that, so I got 9 off the top of my head. The other thing that you can find on Northwest Harvest's website is a link to our COVID-19 resources page. On that, at the top of that page, you'll find an FAQ about the 13 county divisions that was jointly written by the 3 NGOs, Northwest Harvest, Food Lifeline, Second Harvest, and it lists out what our 13 county, not just our 13 counties, but what's the division between each of those organizations. And the last page of it has the email just for who you can contact if there are problems with a program in your county receiving food or whatnot. So
great, thank you. And sorry to put you on the spot with that.
No. It's a good test.
I understand. Yeah. Any other questions for Christina? And let me see. Jason, does it look like any hands are raised? I'm not seeing any. All right. I think that's it. Christina, thank you so much for joining us and for your presentation. I think incredibly helpful, and please feel free to stay on for the rest of our call and or leave, whatever you need to do. I know you have 2 kiddos that are probably quite eager to have your attention. And thanks for putting your contact information in the chat box for our members to contact you with more questions. Appreciate it.
Great, thank you. If you don't mind, I'm going to hop off because I am starting my first vacation since last June, so I'm going to hop off now, but thank you.
Well earned, and congrats. Thanks.
Thank you very much.
Thanks, Christina.
Have a great weekend. Bye.
All right, Jason, if you can forward on slides then to an update with the governor's office. And Nick and Scott were unable to join us today, but we have Sherry on the line with us. And I know, Sherry, you've been working closely on some of the guidance things, but probably not everything. So if you are willing to kind of just give us an update of what you can, and then perhaps we can start putting some questions that we have in the chat box for you to take back to your team that might be helpful as well.
Yeah, that's fantastic. Yeah, thanks very much, Jamie. Yes, Sherry Sawyer, Policy Advisor to Governor Inslee, and as Jamie said, I've been involved in a lot of the guidance documents that we've been putting out to give some guidance to businesses in the varying phases, but certainly not all of them. But I can give you a little bit of a heads up on what's coming. And we'll go from there. And always happy to take some questions, and we can get some answers back to Jamie and the rest of the WASEC staff as soon as possible for anything that I can't answer. I think first and foremost, last week, the governor issued a safe start plan for state agencies to follow for governmental operations. And today he's going to be sending out a memo to all of you through the various local government associations, forwarding that Safe Start plan to you and encouraging you to use it as a resource as you develop your own plans. I think the governor recognizes that local governments play a very critical role in stopping the spread of COVID-19 in your respective communities. So hoping to the extent that it's useful and helpful to use the state guidance, and of course, crafting your own where it makes sense, because as we all know, there's no one size fits all approach to this. So look for that today. I think just generally speaking for phase 3, I think at last count, we have 15 counties that are in phase 3 with 19 in phase 2, and of those 19, 5 that have applied to go to phase 3. So could have almost 20 counties in phase 3 as soon as next week. So phase 3 becomes really important. We do have a template that's available to any businesses that are allowed to operate under phase 3 to use as some guidance for them for their own Safe Start plan. We encourage the use of the template, but they don't need to use it. And we were trying to make it very clear at Jamie's directions that these templates or the Safe Start plan for businesses do not need to be submitted to the state health officials or the county public health officials It's something that businesses need to keep on hand in case any of the regulatory agencies come for inspections. So I hope that's been clear, and I count on Jamie to tell us if with that message, we need to work a little harder on that messaging. That's what we attempted to get across with that template. So that's available to any business that's available to or allowed to operate in phase 3. If it's a business that has already had some guidance in phase 1 or phase 2, businesses are still required to follow those specific guidances for their industry type. However, they will be updated for things like capacity allowances. For instance, restaurants in phase 2 had minimum seating capacity at 5 to a table. Well, in phase 3, they're allowed to be 10 per table. They had no bar seating in phase 2, and in phase 3, they can be at 25% capacity in their bar area. And then also with restaurants, taverns, and nightclubs, which we initially did not slate them to open until phase 4, we are going to be coming out next week with some guidance around entertainment, so that some nightclubs within very, very prescriptive parameters can offer some entertainment at their venues, but it's going to be pretty prescriptive. For instance, no singing in phase 2 because of the way that the virus can be transmitted when people exert their voice, so to speak, with singing, but some limited singing in phase 3. And then, of course, as long as entertainers are practicing good social distancing, I think we're limiting that to 2 entertainers in phase 2, but presumably a full band in phase 3 if they can be socially distanced and wear cloth face coverings. So we're trying to be as accommodating as we can to businesses, because they have obviously want to get their businesses up and running as soon as possible, and certainly want to make sure that we're doing that with first and foremost with public safety and public health in mind. So I'll stop there just to see if folks have a question on any of that I just kind of blurted out at you, knowing I went kind of fast.
It doesn't look like any questions that have come in specifically for phase 3 guidance, but we do have a question about phase 4. So maybe you can give us anything you can or are able to about phase 4 and what we can expect as more counties transition into phase 2 and phase 3, and kind of that next kind of readiness for our state.
Yeah, and I can tell you that the governor, along with Secretary Weisman and Dr. Kathy Lofi, met this morning to specifically talk about phase 4. Really didn't come to any conclusions about that. I think what the governor's tried to make clear all through this Safe Start phase plan that, you know, the 3 weeks is the minimum, but just because a county's been in a specific phase, even phase 3 for 3 weeks, does not necessarily mean a county will be advancing to phase 4. I think one thing that I can tell you that the governor is really concerned about is the issue of face coverings and having the public wear face coverings when they're out in public, and not seeing a whole lot of compliance in that area. And I think based on what the expertise from public health, that knowing that, you know, what you've all been hearing, that when I wear a face covering, I protect you. When you wear a face covering, you protect me. So how important that face covering is when we're out in public, and not seeing a whole lot of compliance in that area. I know that there is caution with moving to the next phase, because the more people that are out and about, so to speak, the higher risk for transmission. So that is one factor, and he's looking at things like, does he make this a statewide requirement, like, for instance, Oregon just did and California just did. So we're looking at that, because obviously if we're going to be opening up the economy, and which I know the governor is very anxious to do, and all of you are as well, we certainly want to do it in the safest way possible. But as far as actual timing on phase 4 and when county can move to phase 4, we really don't have any specifics on that right now.
Great, thank you. And maybe not what folks wanted to hear, but we appreciate just that level setting as well. We have a comment, I think, more around the phase 3 guidance with the venues and businesses about musicians and performers just needing the work, not just with venues and businesses, that just the wage gap that they have, and working very closely to the poverty line and just being very cognizant of that. And a lot of our gig businesses and folks that work in that entertainment industry being really impacted by this.
Absolutely, and that's why we're trying to get the guidance out there as soon as possible. And as I said, it's going to be fairly limited, especially in phase 2. But we want people to get back to work, and of course, we want them to do that in the safest way possible.
We have another question. Is the Safe Start template, I think the template that's available for businesses, is that going to be required to be completed by counties, or is there something else with that memo coming out from the governor for counties that they should be following or utilizing?
So that specific template is it's a template for, as it's meant to be helpful, so that particularly businesses who might not have the expertise and might not know even where to start with developing a Safe Start safety plan, they can use the template. So it's really a resource. Counties can certainly develop their own. And I would imagine that all of you have one for the operations that you have been doing. And as you start to open up more parts of your county and more operations, you'll be changing those. But you're certainly not required to use our template. It's merely there as a resource.
Great. We have a question, and I'm not quite sure what the specifics are. So Commissioner Shin, if you can unmute yourself. His question is, they have a conflict still between OPMA and phase 3. And so he's just asking when that will be reconciled, but perhaps Commissioner Shin, you can describe what that conflict is, so we have a better idea.
Yeah.
All right, can you hear me?
I can.
Yep, loud and clear.
Yeah, when you look at phase 3, you can have open meetings. When you look at the proclamation, you cannot have open meetings. So they conflict with each other, and we've talked about this for several weeks. I know that WASAC was trying to get some guidance on how those rules would be reconciled, and I'm just curious if anything is going on in that way.
Yeah, I certainly appreciate the question, and unfortunately, it's not really an easy answer. I think the legislature just extended that proclamation to July 1st, so not a whole lot of time. And we imagine that when we will be certainly requesting an extension, because counties will be in various stages on July 1st. And nobody will be in phase 4 by July 1st. That we will probably be taking a more phased approach, as WASAC and several other local government associations have suggested. So when we do get that extension, when the governor goes back and reissues that proclamation, it will have more phased guidance in there phased requirements for local governments to follow for the OPMA.
Well,
that won't be coming. Oh, I'm sorry.
I'm hoping that it will be for counties in phase 3 who have good track records on COVID. I'm hoping that we will have the ability, with proper social distancing and masks, to open it back up to the public and move from there. That's what we're hoping for, because it's really difficult to plan.
Yeah, that makes a lot of sense. And we've heard that from cities, we've heard that from ports. So you're thinking along the same lines as your local government peers. And again, when the proclamation gets reissued from the governor, we would like to have that more phased approach, so that counties such as yours that are in phase 3 have some more additional flexibility. We think that makes sense.
Sorry, I didn't mean to cut you off, Sherry.
No,
this
go
is
ahead.
Melanie. I had emailed Tip a couple of weeks ago, and then I don't remember, one day this week, and he said that just what you said, looking at phasing, working on it, but what you just said makes me think it's not going to be done anytime soon, so we shouldn't expect it within the next couple of weeks. Is that what I'm hearing?
I don't think so, Melanie, and I'll confirm, but I think it's for after July 1st, but I can confirm with Tip and Catherine, but that's my understanding as of earlier this morning.
Okay. So, and I think the email I have from Tip is not from today, so yours is probably more accurate and up to date than mine.
Well, we'll see. But when we talk again on our weekly call, we'll for sure have the most updated information for you to pass along to all your members.
Thank you, Sherry. Appreciate it.
Yeah.
Questions are coming in now, which is great. Could there be mid-steps such as a modified phase 3 or phase 4 modified? And I think that goes back to your discussions with Department of Health and the governor's office on that phase 4.
Are we talking just, I'm sorry, just want to make sure I understand the question. Is that just broadly for phases in general, or specifically for, are we talking for the OPMA, or?
I think broadly for the phases in general. If we can't get to phase 4, is there an opportunity to do some sort of modification? So a potential solution to in your discussions.
I think the short answer is I think so, but we just really don't have any specifics to share right now. I mean, I think it made sense for, for instance, for King County, who wasn't quite ready to go to phase 2, but certainly was beyond phase 1. So we think that incremental approach makes a lot of sense. We just really haven't figured out what that might look like, but we're definitely contemplating all sorts of options because we know how anxious you all are to get things going.
Great. Commissioner Swanek, you had your hand raised, and I want to make sure that you ask your question.
Well, it was kind of thank you. It's kind of a follow-up on what Brian was talking about, but I guess I'll try and be polite and blunt at the same time, so please forgive me on that. No,
I appreciate that. Do it.
What I'm getting from a lot of people is they're sick and tired of micromanagement. Each business has some specific type of plan. I mean, if they followed CDC guidelines and they did masks, then the business should be able to figure out how to socially distance and operate. But the way the system's working right now, it micromanages any type of business. And if there aren't a lot of people that do that business, they don't get guidance forever. I mean, libraries were a really good example of that, because a library should have been able to do the curbside stuff just as soon as the other businesses were doing curbside, but it was 3 weeks later. So I would encourage the governor's office to go with a little broader view and a little less specific guidance for each specific business. I think that's really impeding the way things recover. That's my 10 cents. And I appreciate you letting me give it.
Yeah, of course. And that, I mean, you're not alone in those sentiments for sure. And that's why, while it doesn't get to all of your comments, that's why we tried to be a little bit broad about the phase 3 template, meaning if you don't have industry specific guidance already, just develop a safety plan. It doesn't have to be ours, but you have to have one on your premises. But I hear you loud and clear about the industries that do have specific guidance and how that comes across as micromanaging. And I would like to say that as we move forward, we're really looking at ways to be more flexible. So I understand what you're saying, and we're happy to provide that feedback to the rest of the team for sure.
Yep. And we'll keep track of these questions too for you, Sherry, so that you'll have them and can send them to the correct people within your office too.
Great.
A couple questions. One question that we've run into kind of from the public health side of things is that Safe Start template plan does have in businesses a clause about doing contact tracing. And we feel really, really strongly that public health should be leading that effort and businesses providing that support. So I think if it hasn't already been clarified, clarifying that so that role is, since we're statutorily required to do that work and have that expertise, just to make sure that those roles are very clear in that guidance.
Yeah, and thank you for that. That's a good reminder. We did update the template to remove that, because thanks to you and your peers, we heard that like within hours of posting the initial template. So we did change it. It should be updated to reflect that.
Great.
Yeah.
I think that will be great. That will be very helpful for our folks. Yeah. When you're talking with the masking conversations, some of our counties have passed mask directives, whether that's the county themselves or their boards of health or their health officers. And so just, I guess, offering some of our lessons learned from those masking directives into that conversation and making sure that those masking directives are considered too, and that importance of kind of that local control for that larger state discussion.
Yeah, that's great.
And Melanie has shared some guides for state agencies. Really helpful. Other questions for Sherry? And if
I
I've missed,
see Commissioner Price Johnson's comments about the 2-week window for OPMA being problematic. Couldn't agree with you more, and we wish we could do something to address it. And just please know that we don't ask for just a 2-week extension, but that's what we get from legislators. So any help that you all can provide with the importance of making those extensions for a longer period of time would certainly be helpful.
absolutely. Any other questions for Sherry? Melanie, Eric, do you have anything for Sherry?
Sherry, I would just say that not having the phases figured out for the OPMA guidance makes it difficult for some of our counties to lobby for an extension of that because they would actually prefer to be meeting in person and they're prohibited from doing so now. So it puts probably some of the counties who would be in the best place to have the best conversations in a really difficult position. So I just wanted to make sure that you all understood that, and I know it is what it is, but I did want to mention it.
Okay, you know what might be a good idea, Melanie, is maybe on Monday, I can set up a call with Tip and with Catherine and yourself and your city and port counterparts, and we can have this discussion and just kind of lay it out there and see where we can go next.
That would be fantastic. Yeah, I will happily make myself available. Just let me know.
Okay, great. Thank you.
Thanks, Sherry.
Hey, Sherry, this is Eric. Thank you very much for joining us. I just wanted you to talk to the group a little bit about, because it's a question that I'm surprised actually no one put it in into the chat box, because it's one that I get almost every day, either in email form or a call or a letter commenting about when will the state release what a lot of our members believe is monies that could come to cities and counties under 500,000 people, where there was almost $540 million that could be made available. The governor's office has released 300 million of that, 297 million to be specific, leaving well over 240 million that could still go to cities and counties under 500,000. And the way you've crafted that at the governor's office is that we only have till October 31st to spend that, the money we've already received. So if that's going to hold true, the time is getting very short for us to expend these very important resources. Could you talk about potentially the release of that $240 million to cities and counties, and how is the forecast looking for that?
I wish I could, Eric. And unfortunately, I think as you probably can imagine that Scott Merriman, the director or assistant director at OFM, he's been more involved in those conversations and unfortunately couldn't be here. But I will definitely flag this one for him to follow up with both you and Melanie on that important answer. We know how important it is. And I apologize, I don't have an answer for you today.
And is there an overall spending plan for the 1.6 billion that the state received? So we could also understand how we should be planning our local expenditures in conjunction with those state expenditures.
I guess the short answer is I don't know, Eric. You know, I'm not the money gal, man. You know that.
Okay, thank you.
But I'm sorry, I'm being flip. I apologize, I don't have the answer, but we'll get one for you.
Yep. For those of you who don't know, Sherry and I, we've worked together a long time. Sherry actually was at the Association of Washington Cities for a number of years. So
well, now they're going to hold that against me, Eric.
Now has a great working relationship with counties from her tenure at AWC. So thanks, Sherry.
Yep. Thank you, Eric.
We do have a question that's come in. How long do you, and you probably don't know the answer to this, but how long do you expect phase programs to last, or the phases to last?
I wish I had an answer to that. I really do. I don't have a definitive answer to that. I don't think anyone does. Unfortunately, I think we're going to be at this a while. And things that you've probably all heard nationally, until there's a vaccine, until we see numbers really, really low, we'll be at this a while. I don't know, I wouldn't even want to venture a guess to what a while means, but you guys are all ending on questions I have no idea what the answer is to. What is up with that?
You didn't think we were going to make this easy on you, did you?
Well, no.
Any additional questions for Sherry?
One Sherry can answer.
A comment about Benton that is, they've been in phase 1 now for over 90 days. Yes, Commissioner Delvin.
Yes, I know that. I know that I know they have a pending application for phase 2. And I know that the Department of Health is reviewing the application and all the numbers and then taking it very seriously, especially with what's going on in neighboring Franklin County and over in Yakima. I don't have an answer for you on when they might make a decision on that.
This is Jerome. We just sent in a 5-page document to answer Department of Health. We try to get a response as quick as possible. That would help to what we sent in today.
Great.
Great. Additional questions? We are a little bit over time, but I think it was very well worth it.
Yeah, can I just clarify something that I don't want anybody to misconstrue what I said? And I see Commissioner Shin has a comment that it's not realistic to say that nothing's going to change until we get a vaccine. And that wasn't what I meant to communicate, if I did communicate it that way. But as far as the phasing goes, I'd be surprised if we got out of phase 4 before there's a vaccine. I am not a health care professional, but that seems to be what the healthcare professionals are talking about. But that's not to say that nothing's going to change. I think, as you know, a lot's going to change in phase 4 when we get to that point. And then the comments that were made earlier about maybe some incremental phase in between phase 3 and phase 4. So things are certainly going to change. We're not going to remain static. But as to when things are going to be back to normal in terms of how we live our daily lives, I just have no way of knowing. And I would be I'm just repeating what I've heard about. It's probably not going to be until there's a vaccine. But again, that doesn't mean things aren't going to change.
Hey, Sherry, this is Eric. This is a good question from Commissioner Swanek, and maybe I'll just rephrase it a little bit. And I know you're the policy side, not the budget side, but when coming into special session, will the governors and OFM put forward a revised, for lack of a better term, supplemental budget of where they're proposing reductions to occur, or will they leave that to the legislature? What's the step process right now? And I know, Melanie, you're going to talk a little bit about special session as well, but what is OFM's perspective on proposing what either on the revenue and expenditure side would look like? In particular, I guess what we're most interested in, as you can see, is state funds that support county programs.
Yes, don't have a real good answer on that one either, Eric. I do know that David Schumacher, the director for OFM, is working with the budget writers in both the House and Senate, so that when a special session is called, and we all think one will be called eventually, please don't ask me when it's going to be called. Maybe Melanie has good information on that. That we have some sort of at least coordinated approach to this. I mean, within reason. I'm sure that there's going to still be some differences that need to get worked out through a special session, but I know they're working closely together now, especially now that the revenue forecast is out there on what a budget would look like.
Great, thanks.
Yep.
We do have an ask from Commissioner Price Johnson. Would it be helpful for county commissioners to speak to legislators about OPMA?
Yes, please.
Okay.
So let's have the conversation with Sherry and the cities, and I'd like to bring in our contract lobbyist, because Mike is really who's had the direct communication with some of the legislators, and come up with a little bit of a plan. And then let me get back to you, Commissioner, and well, commissioners, I guess, plural, with a better idea of maybe who to speak to and what the best talking points would be. I know at one point I had asked for you to, and then I talked to Mike, our contract lobbyist, and he said, no, we've got it under control, don't worry about it. And now we know that under control is a very loose term, and it might be time to rethink that. So I know people are getting really frustrated, and you know, hopefully we'll get it sorted out, but let's have that conversation with Sherry first.
Speaking of proclamations, can I say one more thing about proclamations? So the proclamation that extended the deadline for you all to file your financial statements with the state auditor's office, that also was extended to July 1st. And in my conversations with the state auditor's office, they're thinking that they don't need to ask for another extension. So I don't have a window into how local governments are doing in terms of their filing. But if you think that that needs to be extended, I just think that would be worthwhile communicating that to the state auditor's office, because they, at least as of right now, they don't think that they need to ask us to ask for an extension on that one. So I just want to communicate that.
Thanks. And then we have a question from Commissioner Peck, and perhaps this is one that I can take to Department of Health. Rather than governor's office, but separating out COVID cases from inmates versus general population, and kind of making sure that data is clear and represents the data that's being used is accurate. And I know that's been an issue in recent days in the news around DOH's data numbers. All right. Any more questions for Sherry? Seeing none. Sherry, you did a fantastic job covering for Nick and Scott as well. So very well done. The hot seat is over.
Phew. Thanks, everyone. Really, we take your concerns really seriously. We're trying to provide some flexibility for you all here. So hang in there with us, and we'll continue to work with Eric and Jamie and Melanie, and hopefully get some more flexibility for you all in the coming days. So thank you very much. I hope you guys get a weekend.
Absolutely. And we will gather all of the questions and make sure that you have them as well. Much appreciated. Thank you for joining us today. I know your time is very valuable as well. So appreciate it. Thanks.
Of course. Yeah, anytime. Bye, everyone.
Bye. Thanks, Sherry.
And Jason, feel free to go to next slide, and we'll do a quick update. Commissioner Swanik's question around special session fit in very well. And Melanie, I'm going to turn it over to you to give us the latest in what we are hearing, not necessarily what's happening, but what we are hearing.
Well, I mean, I'll start with the fact that it seems like what we hear changes almost on a daily basis. So it really just kind of depends on who you've spoken with and when you spoke with that person. But first of all, I just want to say that I thoroughly understand your frustration, because I am extremely frustrated by hearing that the governor's office has not dealt with the phases for the OPMA. I first reached out to council at the beginning of June and was told they were exploring it. And then I reached back out earlier this week, which was a full 15 days, I think, after I had asked in the first place, and was told that they were working on updated proclamations, and then to hear from Sherry that maybe we won't have them for a couple of weeks. I think that is just extremely frustrating. So I just want you to know that I appreciate that you're frustrated by that. And I think we'll have a good conversation with Sherry on Monday and then figure out how to go forward. Conveniently enough, we have a conversation Monday afternoon with all of the single county and contract lobbyists. So I had already made a note to put this on that agenda as well. So we will keep working on it. So special session rumors. First of all, for those of you who haven't read the really exciting revenue forecast, I'll just touch on that quickly. The U.S. is now officially in a recession, and at the state level, we have a near general fund decrease of $4.5 billion for the 19-21 biennium, and a $4.3 billion decrease in projected revenues for the 21-23 biennium. It's good to remember, though, that we do have a near general fund budget of about 52 billion, and we do also have, I think, over 3 billion in reserves currently. So as rightfully freaked out as this makes people, it's not the same situation that we were in with the Great Recession. I went back and looked, and then actually was confirmed in an article that I read today. In 2009, it was also around a $9 billion shortfall, but it was over 2 years, and we only had a $36 billion budget. So from a percentage basis, the hit was much bigger for the Great Recession than it is now. Same dollar amount, but you know, working from a much different position than we were back then. So legislators have said that both cuts and new revenues are going to be on the table. The general consensus from the majority party is that they don't want to cut their way out of this. They think when they did that in the Great Recession, that was not the right thing to do. They think it actually made the recession worse. And so they are potentially looking at various revenue options. Now, whether they look at those during a special session, I think is a whole different story. My guess is revenue, probably not, but that's of course a guess. The governor has called for eliminating the 3% pay increase that just was passed this last session, but he is only doing it for exempt employees who make over $53,000 a year, and only employees that are within his purview. So he can't change the legislative branch, judicial branch, or separately elected employees. So this really is only affecting 5,600 employees out of the tens of thousands of government workers we actually have. And then he is also asking for 1 furlough day a week from June 28th to July 25th, so probably 4 in the next month, and then an additional 1 per month through the fall. And I don't know what through the fall means. I don't know what date that is. And that apparently will have a broader impact of about 40,000 employees. So he's anticipating that that's about 55 million in savings. If the other branches and separately electeds do it, it bumps it up to about 91 million. So that's kind of just the status of where things are budgetarily. Rumor on special session currently is a 1 to 5 day session, assuming they have deals worked out going in sometime in early August. Senator Rolfes, who is the Ways and Means Chair in the Senate, has said we might have more information next week. We've heard rumors that legislators were asked to check their schedules and report back for certain dates in August and actually September as well. Some legislators still think we don't need a special session. Some think we do. Some say that we should be having major policy discussions in a special session. Some say we should not be. The one really actually that comes up more is not really COVID or tax related, it's police reform. So potentially something like that. So you know, we have been working with Representative Paulette and Representative Gaynor and our local government champions on some fiscal flexibility ideas. It's not really anything that should be new to any of you. It's all things like taking away non-supplant language for a specific period of time, stuff like that. So not really any new ideas. And Speaker Jenkins and House Majority Leader Sullivan have both said that there will be a fiscal flexibility bill for local governments, and that they know we've been working with Representative Paulette. And so that's all good news. And we'll continue working on firming up the ideas, and the ideas to go in with a bill that's pretty much not debatable, you know, pretty much agreed upon, and which means it won't be anything that has been controversial in the past or that would be controversial now, which is why we'd be doing things like putting timelines around removing non-supplant language, things like that. It wouldn't be permanent. So that's the type of stuff we're looking at in the near term, and we will definitely have it ready if we do in fact go to a special session. And then if we don't, we'll have it probably as part of a package for the regular session, which, you know, we're still working on developing plans for that. So, you know, a couple days ago, the rumor I heard was not at all or not till November. And now we're talking about August. So stay tuned. Next time we talk, it probably will be just something else, but that's what we know for now. Did anybody, let's see, anybody have any questions?
Yeah, there were a couple in the chat box, Melanie.
Let's see. So based on Washington Wire, the cut needed is in the 1921 cycle is 5.7 because of money already spent / obligated. That's possible. I didn't read that article. I have seen lower numbers, so I don't know that for sure. I believe you, but I haven't seen that. And then let's see, how good are the revenue forecasts if we are in the phased reopening for many months? Great question, and the answer is it's their best guess. When they do the review, they actually do a range from their kind of most pessimistic to their most optimistic, and then they have, you know, I know they have, you know, reasoning behind why they pick what they pick, and so it's certainly not a certainty. It could be better, it could be worse. If you know, if the COVID goes away for some reason and everybody gets back to work, it's going to be better. If we have a really bad second wave and, you know, we have to shut down again or something, it's going to be worse. But this is based on the data that they have right now. They think this is a reasonable assumption. And also, I would say, just none of this is good news, by the way, but to make it sound less bleak, they are anticipating about a 7% drop, but then after that, a 9% increase. So it does look like they expect it to bounce back, hopefully relatively quickly, and this won't be a long multi-year recession like we've seen in the past. So fingers crossed that they're actually right about that. And, you know, the phrase that I've heard repeated so often about how long is this all going to last is that it all depends on the virus. And the only way we can combat that is by, you know, doing all the social distancing and the masking and all that kind of stuff. And we just can't, unfortunately, we can't control it and we can't predict it, but I hope that we end up doing better than what they predict and not worse. Did anybody else have anything?
I'm not seeing any. Melanie, any questions for Melanie? Feel free to unmute yourself. I think we've covered OPMA pretty extensively in our update with Sherry. All right. We are over time. Thank you, Melanie. Much appreciated. I think it's an evolving situation, but one that I know everybody is kind of just waiting for any sort of decisions to be made. We are past 4:30 significantly, but if there's anything that anyone wants to bring to the greater group, please feel free to do so. We'll hang on the line for a few more minutes.
Can I make a comment for a second, Eric or Melanie or Jamie? Art Sonic.
Yeah.
So one of the things on the OPMA that I'm running into, and one of it's with Freight Board, is it's really darn near impossible to strategic plan over Zoom. When you start getting into complicated, nebulous subjects or things like that, and we're also dealing with a marijuana hearing someday in the future, that there's no way we're going to do that over Zoom. We really need the OPMA to be modified so we can have some gatherings where people can work on complicated subjects together when they need to. And I guess that'd be a point I'd say when you're talking about this with people. You know, our freight board needs to do strategic planning for the next several years plus session. And this is great. I appreciate all the info we get off of it, but it's not that face-to-face that you need to do that job. So.
And I'll tell you too, that I know that the governor's office had asked for the OPMA to be extended, I think, until August. And the legislators wouldn't go past the expiration of the current emergency order, even though it's pretty apparent from the state of some of the counties that it's going to have to be extended. So to some extent, I'll tell you that I think they're doing the best and that they can. And in the other regard, of course, obviously, I told you I was already frustrated, but I think you're right in terms of some of the big issues.
There's a markers over there.
Definitely something lost by not being in person, and they are going to start feeling that as they start trying to figure out how to go into a special session as well, I think.
That's what I was wondering. Can they actually go in special session with the restrictions on OPMA they got right now with all of their
Well, it doesn't really apply to them.
Individual agencies? That's what I was wondering.
Yeah, the agencies, yes. The legislature doesn't really apply to them. But it is going to be difficult. I mean, obviously nobody has a clue how we're supposed to lobby. How are they going to do caucuses or breakout meetings, or are they going to try to do committee hearings? You know, I mean, are we going to have to go through, like, a bill is introduced and then it goes to this committee and then it goes to that committee and then it goes to the floor? I mean, how is all that going to work is something that they've been talking about for a while. And I understand they've come up with some ideas, but I don't know that they've got it fully figured out yet. It's going to be complicated.
This is Brian. Can you hear me?
Mhm.
I'd like to tag on what Art said this time. And as I said earlier, we need some flexibility on a county by county basis. And I don't know about Whitman County or the other counties listening, but I'm not lobbying for more extensions. Hell no. We need the flexibility to be able to do what's best for our counties and our regions. And I don't know that Sherry, I think she understands we want flexibility, but that starts at the top. And as Art said earlier, we're not a one size fit all. We need to be able to phase in our own controls safely. And he has to trust us to be able to do that.
Yeah, point taken. Does anybody else have anything for me or for anyone else, for Jamie or for Eric? Eric, I don't know if you have anything you want to say to close it off, close it out, whatever the right terminology is for hanging up.
Yeah, no, great. Thank you all very much, and I appreciate Commissioner Shin, Commissioner Swanek. You know, we clearly have been articulating this issue and the conflict that exists within allowing, you know, us to, in counties that are the phase 3, to have meetings where 50 people can be present. And we should be able to then conduct potentially an OPMA meeting with those parameters, with the proper social distancing. So we've been articulating that, as you heard that from Melanie. We've been talking about the conflict that exists within that and allowing us to begin to initiate that. So we certainly are, you heard it probably more frustration in Melanie's voice. If you could hear some of our Tuesday morning conversations with Scott and Sherry, who we all have known a while, they get pretty frank and pretty honest. So we share your frustration. We share the frustration that there's not enough movement on this specific issue in particular, where you heard, I think, the start of this from both probably from Sherry and Jamie. We're going to have well over half of our counties in phase 3 that could actually even have the opportunity to legitimately have these types of meetings where we need to have the public present for the dialogue that we're having, whether it's a planning commission meeting and land use issues, whether it's the types of things you're talking about as we begin to talk about budget reductions, being able to have those conversations with the communities and having those face-to-face are all going to be really, really important. And we will continue to articulate this point, I think, pretty succinctly for you. And hopefully we can get some resolution to it as part of the July 1 order proclamation, but we certainly hear you loud and clear, and probably may need you to begin to articulate that to the legislature so they understand it better as well. And I really do appreciate all your work, and I appreciate I appreciate the directness and the respect that you are providing through this process. It's frustrating at times, but it's also everyone's kind of learning it as we go. But this is one of those elements where it seems like there's a common sense approach for us to be able to achieve, and I think that's what we're trying to articulate right now. So thank you all. We've got a couple of meetings coming up, I think, next week that you've got invites from, I think for both Monday and Tuesday, if I'm not mistaken. Jamie or Melanie, you can chime in here, or Derek. I'm not sure if Derek's on the line, but we do have a couple meetings scheduled coming up dealing with both the variance process as well as CARES COVID virus relief funding. And Tony will join us again from Department of Commerce. So we've got a couple things coming up next week for you to join in as well.
Yes, and those invites would have come from our general WASAC email instead of Eric. So you may have missed it. So don't look for Eric, look for the general WASAC email for that invite. And I don't have anything else. Wish you all a very good weekend.
Yeah, have a great weekend, everyone.
Thanks.
Yeah, thank you.